when you were a volunteer, what were sort of the rewards as a volunteer?
Well, there were
benefits.
It was great to see the look on his face when I told him that I was there for him, and that and when he really got it, you know, that I wasn't going anywhere, that I was there to listen, and that he was going to be the focus of the relationship. And once he got that, and then when I would show up and I would see the look on his face, he would be so happy that I was there for him. And you know, there is something to be said for that warm, fuzzy feeling you get when you make a difference in someone else's life.
I know. And we were just talking about all the volunteer work you do, so you must be like Mr. Smiley.
Not warm and fuzzy, but hot and hairy.
Oh, yeah. Good. Just like your dream. As... Woo.
Sorry.
Rewind. So besides the peer support volunteer program, you mentioned a little bit about the other services that Shanti provides. What are the other breadth and depth that they provide?
Well, I mentioned the activities department, and next to that we have care navigators, like case managers, that help folks access the services that they need. The volunteer support program, and then we have the LIFE program, and LIFE is an acronym. It stands for Learning Immune Function Enhancement, and it's for HIV positive people, and we're adapting it for the breast cancer folks. But what it does is it looks at the mind, the body, the soul, and we give strategies, and we go through exercises that help people to enhance their wellness, their overall well-being, in a variety of ways. It's a long course. I believe it's 17 or 18 weeks, and they meet once a week.
Wow.
And it's intensive, but it's also very social, and it's meant to build community as well as individual enhancement. So
I had a question and then it left. So you guys are in San Francisco, based in San Francisco. Why do you think that it was such an important organization to have in San Francisco and to still be here for 35 years?
Well, this is where we started, you know, and I think that it was certainly our founder, Charlie Garfield's, to his credit, that he started this in the East Bay with cancer patients, and they moved into San Francisco when the AIDS epidemic came. But it's certainly a big part of the San Francisco model of care, in that it accesses and nurtures a part of the individual that medical science doesn't get to, and it augments the scientific end of care, of HIV care.
And do you think that San Francisco is, I don't know, because I've found that San Francisco is so much different than maybe any other city, or, you know, sort of the openness and the willingness and the wanting to help sort of everyone being really open-minded. Do you think that sort of makes a difference for you?
Oh gosh, sure it does. Sure it does. The climate of San Francisco, the people here care and give, and people who give tend to give more, I have found, and not just money, but time and energy and ideas. And facility, and things like that. So I think that it's we're certainly well suited for the San Francisco area, but we have adapted our I should say our model has been adapted in cities across the country.
Oh, good. So. And so when I know you were talking about AIDS and HIV, so why did they make the change to sort of include the breast cancer within that?
Well, I think it was a combination of factors. I think we were looking for a way to expand and find new populations that would benefit from our services. I think there was an idea that we should try to go back to cancer because that was where we started, and then certainly with the modern treatments for HIV, we're seeing less of a demand for HIV services. So we had more to give to other areas.
Interesting.
So.
And then, do you have any sort of nice, warm stories that you want to tell us? Do you have any clients or volunteers in particular? You don't have to say their names, but any sort of stories of niceness
Niceness.
that you want
Well,
that you have sticking out in your mind that you could share?
Tell a little of my own story.
Okay.
As a client, and there were times over the years when I could barely get off the couch, where I would. It was basically bed, bathroom, couch, bed, bathroom, couch was my life, and Ashley would come. She's my current volunteer, and she would just do little things around the house, but it was comforting just having. I live alone, and it was comforting just having somebody rattling around in the kitchen.
Right.
You know how when you're sick and mom's downstairs in the kitchen and she's making noise and you can hear her, and it's just comforting.
Or even having someone in the house with you, no matter, just knowing that they're there rather than knowing that there's no one there. It just makes a different feel in the house also.
And even if you don't need anything in that moment, should you need something soon, there's someone there. And I think that is a good catchphrase for Shanti. Someone's there.
Well, that's nice. And we have a phone call. This is a live call-in show. Hello, caller.
Hello.
Do you have a question or a comment?
I actually have a question. I am interested in volunteering, but I wanted to get to know a little bit more about how the actual clients are screened and what kind of is there after the training for the volunteers.
What kind of what is there? I'm sorry.
What kind of support is there for the volunteers after the training is over? Okay,
great. Thank you for calling.
Those are
Chip.
Great questions.
Oh, good.
First of all, support for the volunteers. We provide, certainly the staff, there's a staff available who volunteers can call should issues come up in the relationship. They're not sure, like, ooh, should I be doing this? Or, maybe there was some sort of behavior that was maybe felt inappropriate, or, there's things that come up. But then also we provide support groups for our volunteers, and they meet once a month usually in volunteers' homes, but sometimes in public places. But just for folks to get together and talk about their experiences that month. So we provide those.
Oh, good. And then I think they also asked about the client screening, and maybe the client screening plus the client and volunteer matching. Maybe you can go into
process,
that.
Sure. What we do is at the end of the training for volunteers, they fill out, I believe it's 2 or 3 pages of likes and dislikes. And this can be anything from, I don't want to be around cigarette smokers, to I want someone over the age of, or someone that lives in a specific neighborhood, all sorts of different things. And we do the same thing for the clients. They get to pick. I want a female. I want, her to be over 40. I want her to be available on these days. And so it's pretty what I want to say, substantial. And then the matching process, of course, we look for that perfect match. And we do a pretty good job of it.
Oh, good.
So that on the whole, things do work out.
And then I'm so engaged in what you're saying. I'm like, question, I have a question. And then I'm like, yes, you're talking. Besides the volunteer support program, is there any other way for people to volunteer, not necessarily with a client, but within the organization? Do you guys also take volunteers?
Certainly. We need volunteers for to work in the office in every program. We also need help with putting on events and galas. We're going to have hopefully having our 35th anniversary gala this fall. We'll need lots of help. Not only in-kind donations, but folks who can put in time setting up and doing things like that.
And what are you planning on doing? I mean, I know you said this fall, but if you hear a party, what are you guys going to do for the anniversary party?
We hope to have a pretty formal event, a big party.
Oh, good.
35 years is a long time.
It is. And it's providing good support also, so that's important to celebrate. So we are talking with Chip Supanich from Shanti. If you have any questions or comments, you can feel free to call us up at 621-4473. We only have a couple of minutes left, so get your calls in. So in the next, we only have like 2 minutes. But can you sort of maybe sum up Shanti, give a little bit of information of why people should be interested, or if they are interested, where they should go and find out information. Sure. Do your pitch,
My
man.
spiel?
Yes.
Oh boy. Well, Let's start with accessing Shanti. I think the best thing to do would be to start with the website.
Okay.
Okay, because there's a video there